When it comes to dementia prevention, what would you say are the big levers for most people?
When you look at the data that are out there, and there are several people who've tried to answer this question, and all of them get a slightly different answer, but there's certainly some overlap. So examples include the Livingston report was done by the Lancet. It was a Lancet Commission on Dementia Prevention. This was published a couple of years ago. In 2020. Then there was also a big meta-analysis of over 300 clinical trials and studies by Professor Yuntai Yu that looked at risk factors and sort of ranked them and the size of the effect. And then there have been some other ones historically. And things that consistently come out as important. The most important protective factor ties directly into what I mentioned earlier, which is late life cognitive demand or cognitive stimulus. And then also, and what mainly pops up in these studies just because we have more data on it, is early life education. Because the longer you're in formal education early in life, the higher your peak of cognitive function. So even though it doesn't necessarily change the decline, unless you do some other things, if you start from a higher peak, then then at the same rate of decline, you reach functional impairment or dementia later in life, if that makes sense.
Yeah, you have more to lose before you lose it.
Yeah, exactly. So, and that then fits into my idea of cognitive demand, right? We need to stimulate the brain as we develop it, but then also to maintain that long term. So those are probably the most important protective factors. And then the next one being, or maybe on the same level in terms of size of effect, is physical activity. And physical activity shows up in all of these meta-analyses as being critically important for long-term cognitive function. And that's defined broadly because you're sort of trying to lump these things together. Risk factors, some of the biggest risk factors, you see things like acute brain injuries like stroke and traumatic brain injury. But outside of those, hypertension is a really big one, as is diabetes or some aspect of metabolic disease, insulin resistance. And then nutrient status becomes really critical. So the ones that they've studied the most are probably, again, omega-3 status and homocysteine as a marker of B vitamin requirement, but also homocysteine itself may be detrimental to the brain mechanistically. There are a few things that it might do. And then beyond that, some of the other basics like iron status is really important. So anemia is a risk factor, vitamin D deficiency is a risk factor. And then you can sort of keep on adding nutrients that we know are important, but those are probably the ones that have the most evidence behind them.
When it comes to food for the brain, what would you say are some of the more beneficial foods to prioritize in one's diet?
I think whenever you get into this, people become ideologically entrenched based on the food itself. And when I talk about it, I think that the most important thing to focus on is the nutrients themselves, right? I'm agnostic to where you get them from, but I know that these nutrients are critical. Again, Food for the Brain as a charity was founded primarily with a focus on omega-3 fatty acids and then homocysteine lowering B vitamins. And it was largely founded again because of work by Professor David Smith, who's the former department chair of pharmacology at the University of Oxford, who ran the VitaCog trial, which was giving homocysteine lowering B vitamins, so it was B6, B9, folate, and B12 in individuals at high risk of cognitive impairment and some mild cognitive impairment. And what they saw was that in those individuals who had elevated homocysteine, especially if it was over 13, but probably over 11, so getting them below 11 slowed the rate of cognitive decline and slowed the rate of brain atrophy. But what was interesting is that it interacts with omega-3 status. And there are actually 3 studies that now show this. The B-Proof trial and the Omega-AD trial also showed something similar, which is that when you give just B vitamins to lower homocysteine, or you give just omega-3s, but you don't take the other into account, you don't necessarily see benefit. So you need both a good omega-3 status and you need to have homocysteine below sort of 11-ish in order to see benefit. And this goes back to, and depending on who you ask, some people say that the population attributable risk for dementia, when you combine both of these nutrients, is somewhere between like 20 and 40%. That sounds like a lot, My guess is it's less than that, but that's still a significant contribution to overall dementia risk at the population level. And this goes back to the idea that I mentioned earlier, which is that these different risk factors interact, right? And people will have seen dozens, if not hundreds of clinical trials where they say, well, we gave this one thing and it didn't work, therefore it doesn't work. But we're now increasingly appreciating that context is critically important. So there are lots of studies that show omega-3 supplementation doesn't decrease dementia risk, but you haven't taken the status of these other nutrients into account. And I think it's very easy once you think about what you want that omega-3 fatty acid, so particularly DHA, but EPA is also important, what you think it's going to do. So you want that DHA to go in the brain. You want it to be in the synapses, in the mitochondrial membranes where it needs to be. But in order for it to get there, it needs several things, right? It needs to get into the brain in the first place, which probably requires some degree of metabolic health because some of the transporters are insulin dependent. Not all of them, but some of them. And then you need it to be attached into a phospholipid so it can sit in a membrane. So you need a phospholipid head group. So you need either choline or serine or ethanolamine in order to create that head group. And those, come from things like lecithin and eggs in particular. And then you need methylation to attach those things together and have them be functional. And so that's where the B vitamins come into play. So just thinking about these single nutrients, I think, kind of gets us in trouble. But those are maybe the most important ones. So then, if you eat a whole food plant-based diet, which a lot of people do, then you need to supplement with B12. And I think a lot of people, now we know that, right? And you need some kind of source of long-chain omega-3 fatty acids.
And what about choline? It's pretty hard to find choline on a plant-based diet, is it not?
Yeah, that's right. Unless you supplement with lecithin. So either sunflower or soy lecithin has a pretty good amount of choline. And then most of the DHA in the brain is not as phosphatidylcholine. It's either as phosphatidylserine or phosphatidylethanolamin. But they can be interconverted again if methylation is working properly. So usually what I'd say is if you do some testing, then you know whether you have higher requirements. So test your homocysteine, test your omega-3 status, because some people who do very well on plant-based diets, they have a more efficient conversion of ALA to the longer chain omega-3 fatty acids, but not everybody can do that. It's probably based on ancestry and some other things. So the easiest way to know what foods you should eat or what nutrients you should be focusing on is to try and do some basic blood testing.
Of course.
Hey, if you liked that video, you need to check out this one here, and I'll see you there.